2014, the first case of Ebola was recorded here in West Africa. It heralded what would become the worst ever outbreak of the disease in history. Not only has it killed more than 11,000 people so far, but it has decimated the economies of Guinea, Sierra Leone and Liberia, which is why the international reaction and assistance has been so critical, and the Chinese contribution to that cannot be overlooked. As we continue our coverage leading up to next month's forum on China and African cooperation, tonight we'll be unpacking the scale and effectiveness of Chinese medical assistance in Africa. Ebola decimated Sierra Leone's already fragile healthcare system. It was a devastating lesson for the government as well as its international partners. But it's hoped that hospitals like this one on the outskirts of the capital, Freetown, will help build back a more robust healthcare system so as to prevent any future outbreaks.
Open again. For more than a year, this hospital on the outskirts of the capital was converted into an Ebola treatment unit and holding center. Now, after a thorough clean, it's open to receive patients.
So we have started doing minimal operations, mainly outpatient services for the moment. But today, as I'm speaking, we have started admissions. So the hospital is now fully functional.
And back in their normal routine are the Chinese medical team. During Ebola, Chinese healthcare workers helped here in the emergency response. But since August, this team of 9 Chinese clinicians have been dealing with general services like surgery, pediatrics and gynecology.
We were very happy when we were asked to come here. We were told that it is to maintain good relationship between the two countries, and we were very happy to do that.
Before Ebola, there were less than 150 Sierra Leone doctors in the country. More than 10 of those died during the epidemic. The government's post-Ebola development efforts have focused on building back more robust healthcare services. China has said it wants to help.
But if fever come again,
if fever continue and then come again, because you
have to take another injection.
Yes.
The doctor said if the fever continues, you should come with the boy so that he can have another injection.
The Chinese doctors' services are paid for by the Chinese government. Isata Kamara brought her daughter here for treatment. She's pleased with the service.
The hospital and the duel. The hospital and the duel for the Pikine.
The hospital has been good with the children. That's why we came here. They help us look after our children, and we're grateful for that.
Thank you.
The Chinese government has said that it will intensify its medical assistance to Africa. This hospital in Sierra Leone is earmarked for an ambitious project. Not only new buildings and 10 further doctors, but it's expected to become one of the country's foremost teaching centers.
This hospital is going to be transformed to a much bigger facility. The Chinese government is going to provide some funds, hopefully to build an infectious disease complex at the back of the hospital here. That facility plus this hospital and the newly constructed P3 lab, all of them as a unit, will help to modernize this hospital and help us prepare in future for any outbreak of Ebola or any infectious disease.
The Sierra Leone government has welcomed the Chinese medical assistance. President Ernest Bai Koroma says it's another step towards consolidating bilateral relations.
Chinese medical teams haven't just been helping with the Ebola response in Africa. Across the continent, anti-malaria research and development programs are also being assisted by Chinese experience, such as the malaria control program in Nairobi, Kenya, which is making huge strides towards lowering the number of cases.
Dr. Tui, thank you. Tell me about this lab.
So this lab is our malaria reference lab. This is where we receive samples from the counties and we counter check the slides that they have already read in the county just to make sure that what the diagnosis that they've given at the county level is the same as what we are seeing through the microscope. This lab started some time ago, let's say in around 2008, 2009, with it was a very small room which we used to call room 49, and it was filled with donations from the Chinese, the Chinese government. So it was too small to contain all the equipment, and therefore we asked for more room, and that was granted. So when this particular building was renovated, we have a whole section just for the National Malaria Reference Laboratory.
All right, so you're talking about Chinese support that made this much bigger facility than it is now. What kind of support did you receive from China?
We received support of equipment, very sophisticated equipment, so that we could be able to do one microscopy here, to do molecular biology, especially for something we call PCR, which is a bit more sophisticated than just microscopy, and also do biochemical analysis of samples. We also received trainings on malaria. So we had, I think, around 2 trainings where most of the staff from the malaria control program were trained on malaria, on how to do prevention and also case management of malaria.
How beneficial, though, has this center in itself been in terms of technology, in terms of controlling the rate of malaria?
What it has done, now that it has turned into a reference lab, we are now doing something called quality assurance within the counties to make sure that the microscopy or the laboratory examinations that are done there are of good quality. So this lab has actually made sure that we're able to roll out a whole quality assurance system for microscopy in Kenya. So at least we know that the diagnosis that the patient gets is a correct diagnosis, and therefore then can access the proper treatment. With more sophisticated equipment and with an improved quality assurance system, we can then be sure that if you are actually having malaria, you are actually sure that you're having malaria, and those ones who don't also do not. So you'll be able to know the actual people, which we call a positive or a confirmed malaria case. How many actually have a confirmed malaria, have confirmed malaria.
Tell me about the medication, though, you use in malaria, because malaria is still quite a killer in Kenya.
Currently, we have 2 forms of malaria. We have uncomplicated malaria and severe malaria. For uncomplicated malaria, which is mainly seen in the outpatient clinics, the first line of treatment is what we call artemether-lumefantrine, or generally we call artemisinin combination therapy. That is what we currently recommend. For people who have severe malaria, and that means that they are the ones who are going to be admitted, we are now having the first line called artesunate. Both of them are derivatives of artemisinin, which actually originally came from China.
Are there plans, though, of expansion of this lab, probably from here to the rest of the country? As you talk about, there's still quite a lot of malaria around the country.
There's quite a lot of malaria around the country, and as I told you earlier, we are trying to set up a system. So currently we are setting up 47 county reference laboratories to make sure that there's quality assurance even at the county level. So the sub-counties can send in their slides to the county level, where we'll have laboratory people rechecking the slides. In case they have any queries, of course, then they'll send them up to the national level. So we receive these slides at a quarterly basis, just to make sure, just rechecking the slides to make sure that the quality is assured of the slide reading that takes place within the county. This is very, very important, especially as Kenya is moving towards pre-elimination. We have hope that you're going to move towards pre-elimination, hopefully eliminating this disease from Kenya. So when that happens, we have to make sure that the diagnosis is correct. So that is what that's what we are currently doing, setting up that system.
Well, you've talked us through the whole research lab here, and you mentioned that it started as a room and now it has expanded to quite a big facility here. What kind of support, though, do you think you still require to ensure that what you're hoping for in eradicating malaria actually happens in Kenya?
We are hoping for more support, especially with the recent technology. You know, medicine evolves after after some time. So if we could have the most recent technology within this laboratory, because we've heard of some innovations that have happened in the past, or in the recent past, that would really, really help, so that we can continue confirming and doing quality assurance issues here at this reference lab, and also go ahead and even do some research within this particular laboratory.
Thank you, Dr. Kiptui. Thank you very much.
Time now for a short break, but when we return, Beatrice Marshall with her panel of expert guests will give us further insights into China's medical assistance in Africa. Stay with us. Welcome back to Talk Africa. When the Ebola epidemic in West Africa was at its peak, Beijing sent medical teams as well as supplies such as clothing, disinfectant and medicines to all three countries worst affected by the virus. It was the largest ever Chinese response to a foreign health crisis. Beatrice Marshall asked a panel of expert guests about the scale and effectiveness of that Chinese response and what it could do for international relations.
Let's now broaden this discussion a little bit more, and I have with me in Nairobi political commentator Professor Macharia Munene, and in Beijing current affairs commentator Mr. Victor Gao. Thank you both gentlemen for joining in the conversation. Mr. Gao, to you first though. Africa remembers China's assistance to the Ebola-ridden countries last year, and that was China's biggest health emergency aid for foreign countries since about 1949. But the history of China's official medical assistance to Africa, though, does date to 1963. First, though, in terms of health assistance to Africa, what are the considerations from Beijing?
Well, thank you very much for having me. Even though the Chinese government's assistance to the fight against the Ebola epidemic is one of the most important foreign assistance that China ever launched in the medical sector in the recent decades, China has been very active in providing assistance to African countries since the early 1960s. And even though when China was still relatively poor, China went to the hilt in providing medical assistance to African countries. I remember in the 1960s, China provided many what we call barefoot doctors to African countries, especially penetrating all the way down to the grassroots rural areas, providing very personal assistance to the farmers and the rural population in many African countries. Now China is more developed, and the Chinese medical assistance to many African countries has been upgraded significantly, including not only medical supplies, drugs, medicine, as well as specialized medical teams, including doctors and nurses in many African countries. In China, we are very proud of the Chinese medical assistance to the people whom we are calling brothers and sisters in Africa.
Professor Macharia, though you're listening to this, has this had much impact though since 1963?
Yes, there has been some impact in some countries where China has been fairly pronounced in terms of presence. And as Victor was pointing out, it starts back in the 1960s when China was not very rich. Now, in recent past, other than the involvement in West Africa due to the Ebola attack, we've seen Chinese medical assistance in the form of infrastructure. For instance, in Kenya, we have the Mama Lucy Hospital, which is one of the bigger hospitals in Nairobi. We have the Chinese are helping Kenyatta University to build a referral hospital. This, I think, is a new form of medical aid that comes with not only the technology, but also with the resources and the facility to provide the health services in situ, as opposed to sending people outside for the care that they need. So I think this is a new form of medical aid, other than just sending food doctors in the field to deal with rural areas. So now you have the expansion of that aid in the form of this infrastructure.
Right.
And the hospitals.
You're saying this is a new form of medical aid, though, Professor Macharia. But what does Africa actually see as China's role in Africa's health sector?
Its perception is changing, it's growing, because there was a time when it was not very pronounced. But now we have China being visible almost everywhere, in the medical services as well as in other areas, and where the Chinese go, whether it is in the building of highways or technology, the energy development. Along with it comes some medical assistance in order to help the people involved to not only get better health and therefore be able to produce more. The belief being that healthy people work more and they produce more wealth. So it looks to be part of the total package that goes with an undertaking in which China gets involved in Africa. And in that sense, then it is visible.
Well, is that the case, though, Mr. Gao? Is that the case that China is now enhancing its medical aid? It is a little bit more pronounced now on the continent. And why, though? What is in it for China?
Well, definitely. From the Chinese perspective, we have different ways of looking at Africa. First of all, we have a continental view of Africa, and we have, divided up Africa into the northern part, southern part, eastern part, western part, for example, and we have set up medical centers which actually cater to the different parts of Africa. Secondly, we look at each of the African countries as a unit, and we analyze, where is the need, what is the infrastructure, what is the medical coverage system, what is the network of delivering the services all the way down to the grassroots level, and what is exactly needed, whether it's doctors or nurses, whether it's the drugs, whether it is the service network, for example, whether it will be hospitals and other infrastructure. And I think the Chinese delivery of the services is comprehensive, and it covers a whole range of products and services, including, for example, helping African countries to build up hospitals and clinics, setting up medical training centers, training the local doctors and nurses, not only training them in African countries, but also bringing them to the Chinese medical schools for training. And also really dispatching Chinese medical teams, which include both doctors and nurses, and they sometimes roam around in the countryside from one village to another to provide services on a needed basis to the people in different parts of African countries. And I would say, try to manufacture certain drugs in Africa, helping the countries in Africa to build up their own capacity in providing medical services to their populations, and helping them to really beef up the whole network, national or even continental medical services health delivery system. I think this is all what China is doing right now. China is very busy in different parts of Africa, providing these services. What's the rationale? I think, first of all, there is a strong belief that what China needs in medical services is also what many African countries need in terms of better medical services. Secondly, I would say, China believes that we have the capacity, we have the capability, we have the track record in providing good medical services to the population on a very massive basis. And what we can do here in China for the Chinese people, we want to do similar things for the African countries and African people. And I think this is completely out of goodwill. There is no separate agenda to that. And many such deliveries of services are free of charge, for example, as part of the official development aid by the Chinese government to different African countries. And I truly believe that this will further intensify in the coming years and months, and the Chinese deliveries of medical services and goods and drugs and equipment, etc., in Africa will be further increased. And I think the majority of the people here in my country warmly support that, and they actually very much appreciate the Chinese government's initiative in this regard.
Professor Macharia, two things there. One, of course, the whole question of building Africa's own capacity, because Africa cannot always depend on foreign assistance, though, to build up its medical assistance or medical healthcare systems and so forth. What is Africa's capability, though, in taking advantage of the Chinese technology and the Chinese current assistance to build its own capacity?
It comes down to the policymakers, because the challenge is for the leadership in Africa to embrace the opportunities arising from relating to China. And if the policymakers push the right policies to build capacities, identify the youth who have the potential for being very good doctors or good nurses, or for using the technology that is available, so that they learn, and having learned from China itself, they come back to Africa, not just to replicate what the Chinese are doing, but to improve on what the Chinese have done, because there should be a continuous process of learning and adding to knowledge. If it turns out that the African peoples and their leaders will simply borrow from the Chinese and stay put, that will be a disaster. But borrowing from Chinese, learning from them, and then improving on what the Chinese have will be a wonderful thing. And I think the Chinese will also be happy about that, because they will also benefit from the improvement that will come from the Africans.
Professor, what is it, though, that Africa wants out of this?
The African peoples, of course, they want to feel good. They want to improve their health so that they can improve their wealth. They want to live in a secure world. They want to ensure that they are not always worried about whether they are going to be victimized or to die because they could not get the basics that are supposed to be normal for other people. So if the Chinese can help in that regard, and if the African peoples can take advantage of that by learning and improving on it, and therefore you are going to have a very good future that will benefit both sides, both the African side and the Chinese side, because I think it's what the Chinese like to think of as the win-win situation as opposed to a one-way traffic.
And that is the question, though, Mr. Gao, because the win-win cooperation here, and instead of a one-way situation, though, in the long term, what is China's long-term strategy in terms of Africa's in terms of medical assistance to Africa?
Well, first of all, I would say, objectively speaking, in many African countries, the delivery of medical services, equipment, doctors and nurses to those in need is relatively backward, and it's highly preliminary or rudimentary. And I think there is a big room for further improvement, but that requires huge investment in terms of financial capital and resources, and also mobilizing of the people, in the right direction to make sure that delivery of medical services is one of the many things that the local governments need to perform. And in this regard, I think what China can do is limited, even though it's very active in many African countries, mainly because it would require a partnership between the local governments, the local medical services sector, as well as foreign assistance, including from the Chinese government and the Chinese people. This kind of a cooperation and partnership will be crucially important in making sure that the delivery system in Africa, in different countries, will be deeply rooted in the local capacities, and the foreign countries, including China, can provide assistance in helping rolling out the national capacity building in different countries. In terms, for example, of many different factors, including life expectancy, infant mortality, etc., and the outbreak of different kinds of epidemics, etc., in Africa, there is a lot of room for improvement, even though on the one hand, China is the second largest economy in the world, but on the other hand, in terms of per capita income, China is still relatively backward. But China actually has achieved a very high rate in terms of life expectancy, infant mortality rate, etc. So this is something we take great pride in. And we believe that many African countries can actually move in the same right direction and make sure that the people there will get better medical services, and the coverage and the delivery of the services can be further enhanced by themselves with their own capacities,
Right.
or sometimes with the assistance from foreign countries, including China.
Professor Macharia, though, partnerships and cooperation, that's the word we are hearing here today. And of course, would like to hear whether there have been tangible benefits now for Africa, given the fact that many countries at a varied levels of development. Have there been tangible benefits, though, on the ground? And going forward, what needs to be put in place? What needs to be done to ensure that these tangible benefits are long-standing?
I think the one tangible benefit I can speak of head immediately is the Mama Lucy Hospital in Nairobi. It has come in handy to a lot of people in the eastern part of Nairobi rather than the other big places. So that one is very visible, people can see it. And that hospital is always full of patients getting the benefits that arose from that partnership. The referral hospital being built at Kenyatta University is going to be a big boost. In fact, what it will end up doing is to ease the pressure on Kenyatta National Hospital, which is the largest referral hospital in East Africa. So you now get some assistance in terms of being able to take care of more and more people. As to the prospects, the future prospects, I think since China has been urbanizing very rapidly, and Africa is also catching up or trying to urbanize as rapidly as China, but not quite. At least the experience that China has in providing sanitation, urban sanitation, for health purposes and all those kind of things. Maybe that's what Africa needs to look into, particularly those countries that are slated to for rapid urbanization. What can we pick from the Chinese, and what can the Chinese offer in terms of planning urban areas and ensuring that we don't have mushrooming of slums instead of catered for new residence centers as people move away from rural areas, because they are moving away from rural areas into the urban areas in Africa as fast as possible, trying to catch up with China in some areas.
Right, Mr. Gao, you have the final word on this. Where are we going to see the future prospects in this sector?
Well, first of all, delivering good quality and reasonably priced medical services and drugs to the population is a must by any government in the world, including many countries in Africa. And China takes great pride in offering assistance in this regard. It is truly based on goodwill, and it involves partnership with the local governments and cooperation with the local medical services, doctors and nurses. We in China are very proud with what we have been doing in Africa. We only hope our assistance will be increased in scope and in magnitude and will be welcomed by African brothers and sisters. And eventually, the African people will get better coverage of medical services, and their pains, their illness and their ailments can be relieved and cured more rapidly and more efficiently. This is our hope. And if the African people can live a better life, we here in China will feel happier. That's our goal.
And that's all we have here for you on Talk Africa today. Professor Macharia Munene in Nairobi and Victor Gao in Beijing. To you both, thank you for your insights. That's all we have time for this week. Do join us again next week as we continue to unpack the benefits of China-Africa cooperation. I'm Beatrice Marshall. Goodbye.